Hey guys, in this lesson we're going to talk about how to care for wounds, which from the last lesson you learned about the different types of wounds. So we're going to talk about caring for closed wounds first, known as bruises. So there's signs of internal bleeding and when to call 911. To know these signs of internal bleeding, you're looking for a number of things, not every single one of them, but a number of them: tender, swollen, bruised, hard area of the body. You have a rapid pulse or a weak pulse. Your skin feels cool or moist or looks pale or bluish, vomiting, coughing up blood, excessive thirst, and altered mental state. When to call 911: when somebody is complaining of severe pain and cannot move their body part without pain. You think that the force that was caused the injury was great enough to cause serious injury. Injured extremity is blue. Person is coughing up blood. Person shows signs of shock or disoriented. Hopefully by now, maybe you've heard of this acronym before, RICE. That just means rest, ice, compression, elevation. So that's what you do when you're injured. So general care for open wounds, that was closed wounds. Now we're on to open wounds. First thing you want to do is control the bleeding. Second thing, prevent infection. And the third thing, using dressing and bandages. You want to apply gloves, cover your hands. Cover the wound with the dressing. Apply direct pressure, so you're pushing into the the wounded area, until the bleeding stops. You want to cover the dressing using a bandage and apply more pressure. But if the bleeding doesn't stop, you have to call 911. And obviously, always when you're finished, you wash your hands with soap and water. And before that, take off your gloves correctly in the proper way. Preventing infection, the best line of defense is to clean the wound. Minor wounds, you can see, wash the area with a lot of water, use soap to cleanse. Signs of infection can be it's swollen, it's red, it really hurts, throbbing, there's a discharge, and you could also be developing a fever. Doesn't have to be all four, excuse me, to know that it's an infection. All open wounds require some type of dressing and bandage so that you can control the bleeding and prevent infection. So even if it's not bleeding, you still want to prevent infection. Pads have to be placed directly on top of the wound so that it can absorb the blood and prevent the infection. And the other, occlusive dressing, which is a bandage or dressing that closes the wound, or a bandage used to wrap or cover a wound to keep the dressing in place. And there are three types of bandages. We all know, the Band-Aid is always the popular one. Adhesive, bandage compress, or roller bandage. Adhesive, different sizes, nonstick gauze, on a strip of adhesive tape, like a Band-Aid. Bandage compress, a very thick gauze dressing that's usually tied in place and designed to control severe bleeding. And then a roller bandage, which is rolled gauze or gauze-like material that can absorb blood and wrapped around the body to keep tight and in place for compression. So of course, there's special situations like a severed body part that you have to take the severed part and put it on ice right away. Just like you've ever seen in movies or TV shows, it is true. Having an object that is embedded or stuck in the body, never, ever, ever remove it if it's stuck, like the nail in the foot, knife in a body, etc. And of course, controlling the bleeding. And number one, going to the hospital. Probably should have put that first. All right, that's it for now.